Hello, my name is Teresa Cachinos, and I'm going to be introducing you to some information on low-income families, diabetes, and nutrition education. We're going to start off by defining low income, and that's really started with the federal poverty guidelines, and it's what welfare especially uses, as well as other people, to measure a household's income to see if they're eligible for programs. So for 2017, the guidelines were just over $12,000 for one person. For a family of three, or a household of three, it's just over $20,000. And then for a household of five, which would be like two parents and three kids, it is $28,000. So if we step back and look at some of the census data, in 2015, roughly 13.5% of all Americans were living at or below that federal poverty guideline that we just talked about. Of American children, so individuals 18 years and younger, 19.7% of all American children were living at or below that number. And we can also see that 12.4% of Americans aged 18 to 64 were living at or below, and then 8.8% of elderly or Americans 65 years and older were living at or below that number. For these individuals, depending on their income and their specific situations, there are some assistance programs that are available to them, like SNAP, WIC, and commodity foods. You can feel free to take a more comprehensive look at this list. I'm not going to list them all, but most of them are listed here. So next we're going to briefly talk about diabetes mellitus and diagnosis and nutrition education related to that. So a clinical diabetes diagnosis, depending on whether it's type 1 or type 2, can be done with C-peptides, autoimmune markers, which are specifically for type 1 and can be used to differentiate between the two. But you can also use hemoglobin A1C and then fasting, oral, or random blood glucose. So for individuals who have diabetes, their nutrition plans should really be individualized, and they should be seeing an RD or a certified diabetes educator. According to the Academy's Evidence Analysis Library, they recommend lower calorie diets for people who are overweight or obese with type 2 diabetes, that individuals increase their fiber intake and avoid eating too many non-nutritive sweeteners, as well as reducing sodium levels in people with hypertension, and of course, as always with everyone, drinking alcohol in moderation. Nutrition education in individuals with diabetes, there have been found to have some beneficial tactics like cognitive behavior therapy, social learning theory, behavior change strategies, and motivational interviewing. However, when you do education, whether it's individual or in a larger group setting, managing diabetes, exercise, and then in low-income populations especially, how individuals can use their SNAP benefit to their benefit. So now we're going to get into potential future programming for low-income families and with a focus on diabetes education. The first thing you need to look at is the reading comprehension of low-income families. 93 million Americans read at or below the level needed to really contribute successfully in society. 3 out of 4 people who receive welfare can't read for whatever reason that they may have. 50% of unemployed individuals between ages 16 and 21 can't read at a high enough level to even be considered literate. And an 8th grade reading level is generally considered to be the standard. However, many low-income families don't even make this mark. So when you write and educate this low-income population, you really need to focus at writing below an 8th grade reading level. So the 3 potential objectives for nutrition education of low-income families and diabetes would be that they would be able to explain 3 key elements of a healthful diet, whether that relates to prevention or management, that they're able to risk 2 risk factors for type 2 diabetes, and that they are able to identify 2 local resources or programs, if they're regional, state, or federal, that are available to them. So future potential programming for this population, I see kind of two ways that you could go with it. One would be prevention of diabetes in low-income families, so that would focus on healthful diets, exercise, what the risk factors and what the symptoms are of both type 1 and type 2 diabetes. And then the other one being how to manage diabetes as a low-income family, and that would focus as well on a healthful diet and exercise. This was kind of just a broad overview. I'm open and willing, and I'd love to hear feedback on my learning objectives. You know, do they fill the need for this population? Are they written at an appropriate comprehension level? Are the objectives realistic for this comprehension level? And are they aligned with the best practice of writing learning objectives? Do you have any constructive criticism or feedback on my intervention? Do you have any recommendations, comments, questions, just general things? And then is there anything that you feel should be specifically addressed during programming? And thank you for listening to this presentation. Again, if you have any questions, comments, whatever, I'm open to hearing them. Thank you.